Hi, I'm Rob, and this is my IO OSCE for CLS 202. So as with any scene, I would arrive, consider personal safety and also peripheral safety, and also wearing all the protective equipment, particularly a mask if it was during the COVID, which it is at the moment. I'm going to assume at this stage that I've already met Mum, and Mum's explained to me a little bit about what's happened, and I've taken some vital signs. I've also thought about what the vital signs are for a 1-year-old, which is a little bit different to children of different ages and also adults. So I've considered all of those, and I'm now ready to give the patient an IO infusion, which normally goes proximal or distal or proximal on the tibia just below the kneecap, which is a fairly difficult thing to do for a neonate, so I would definitely be calling for backup at the very beginning because it's something that I'm not familiar with on pediatrics, so always thinking about backup as well. Having all these sharps containers and everything else handy, ready to go, so you're not having to stop the procedure and go and find stuff. So once when you do get to work with the patient, making sure that you're working with the patient's level and not sort of being dominant and speaking over them, making sure maybe they're sitting in Mum's arms or Mum or Dad is very close by so they can comfort the child, because a paramedic coming to the child with something that looks like a drill is probably not going to make them happy, put it that way. All right, so we make sure that the patient is laying supine and we can expose the site. So in this case it would be the leg, so we would ask permission to remove the pants so we can see the leg. We'd identify the site, as I said, it's either proximal or distal on the tibia, which is just below the knee. I would swab the site with a cross method to ensure that it's clean, and then maintain a non-touch technique in that particular area because it's now being cleaned and it is considered a sterile site. We'll then remove the needle from the package, identify where it needs to go in on the baby. So in this baby's legs, obviously we can't see a knee, but I'm just going to assume that this is below the kneecap. You would be looking to go in at a 90-degree angle, so sort of, not at an angle like this, but directly into the leg. But before you did that, you would attach the needle to the driver. Sometimes it can be a manual driver, or sometimes it can be something like a screwdriver. If it was something like a screwdriver, we would line it up on the site. You would still alert the baby and the mum that, hey, this bit's going to hurt, so just be prepared for that. And squeeze the trigger lightly, allow the drill to go through the skin and then start to go through the bone. You may need to apply a steady pressure as that's happening. If you hear it pop or if you feel it stop, then you need to just release the trigger straight away, and then you can slowly you can press the release button and release the needle and the sheath, and then remove the needle straight into the sharps container. You can put the driver off to one side, making sure that it remains aseptic, and then you can connect, we need to flush that first with 5 to 10 mils of saline. We need to put some adhesive around there to keep it in place so it's not going to move, and we need to pressure infuse the saline into the IO site, and that can be done a number of ways, either manually, you can put a blood pressure cuff around the bag, but basically we need a rapid infusion of that fluid into the baby. But remembering the baby's only a year old, so don't overdo it. That's about it. Thanks for watching.